Good morning and a warm welcome to the day two of APAC HealthTech Innovation Conclave. We had an amazing day one with participation from leaders of healthcare industry from across the country, policymakers in the healthcare department, and we had our chief guest, the from the state of Chhattisgarh, who is a health minister, Sri Singh, and we were also joined by several directors of AIMS Hospital and NIC, National Informatics Center, Government of India, Director General Dr. Nita Verma. She also joined us, and several interesting panel discussion happened throughout the day, and some interesting and power-packed presentation. And this morning we had an opening ceremony and also state perspective from the state of Mizoram by Dr. Sanghi, who has presented the role of technology and the use of the emerging technologies and integration of technology for uh, public health. Now we come to a very special and relevant session that would be focusing on, and we have some special speakers from various healthcare institutions. So join me in welcoming Mr. Harmandeep Singh, who's the Vice President, Information Technology Wing, Children's Hospital. Thank you very much, Mr. Harman, for joining us.
Thank you. Thanks for inviting.
And we are also joined by Mr. M.V. Subramanyam, who's the Group Head for IT Medicover Hospital. Thanks for joining us, Mr. Subramanyam. Welcome.
Yeah, thank you. Thank you so much.
And we are also joined by Huzefa T. Merchant, who is the Head for IT for Saifi Hospital from the state of Maharashtra, Mumbai. Thank you very much for joining us, Mr. Merchant.
Hello everyone, and a very good afternoon to all of you. It is indeed a pleasure to be part of today's event and interact with so many industry leaders, healthcare leaders.
Welcome. So this particular session would be focusing on the importance of emerging technologies, including machine learning, artificial intelligence, blockchain technology, and robotics. And we would be focusing on changing scenario of state health ecosystem as a result of leveraging these technologies, and also the efficient diagnosis and procedure. So moving ahead with the panel discussion, I would first come to Mr. Singh to share his perspective on the role and integration of this technology in these new normal. At the same time, what has been the change in the ecosystem? Over to you, Mr. Singh.
Yeah, thanks, Sudheer. The scenario in the past 1 year has changed drastically in the way we deliver healthcare across the world, I would say. So previously, specifically in India, people used to come to the hospital for healthcare needs of theirs, whereas now in these COVID times, the scenarios have changed, and there has been a huge demand in terms of delivering healthcare to people at their home. People don't want to travel, and then until unless the scenario is really in terms of an emergency, and they're not recommended as well. So in the last 1 year, I would say the pressure in terms of delivering the technology to people's homes have increased, and this is where in terms of virtual consult, in terms of providing medication at home, even diagnostics, all these have really become a challenge for a hospital chain, whichever it is. So now this has been a drastic change, and for healthcare leaders like us, you have to adopt newer technologies at a very much at a faster pace, I would say, rather than the way it has been in the past. So at the same time, you really need to take care of the security of the patient data. Ultimately, you are exchanging data, whether it's video data or any other sort of data with the patients through channels which have to be secure so that there is complete confidentiality and integrity of the data is maintained. Whether it is through online portals, whether it's through video chat, whether it's through the people may be using your app and things like that. At the same time, the doctors have to be very the doctors have to be enabled to use the technology, because in Indian hospitals it has been the scenario that people have been more friendly in terms of providing prescriptions over a piece of paper. So a lot of doctors have not been tech savvy while giving physical consultations. So we have to come up with solutions which are easy to use, wherein you can leverage specifically machine learning to understand what kind of patients are coming to a particular doctor in terms of their principal complaints, and then AI and machine learning assisting the doctors to come up with the diagnostics and medication, and also in terms of investigation and future care plans. So this is the place where specifically machine learning can assist the doctors to key in the data very quickly, to ensure that the data sanctity is there in terms of what is being prescribed to the patients. And at the same time, with this virtual consult coming onto the picture, how you can enable the patients to get access to the medication which is being prescribed by the doctors. So you can leverage blockchain technologies to ensure that all these medications are delivered to the people in time, as well as at the same time ensure that no counterfeit medicines are being sent. So you can have tie-ups with multiple providers, or you can run your own network to deliver these medications to people at home. And also in terms of the investigations. So I think in the past 1 year, it has been a really challenging task for all the hospitals to learn all these technologies and to leverage them for their solutions and to deliver better care to their patients. Specifically, those who are delivering home care packages to their patients who are COVID positive or things like that. So yeah, that's what I think I have to share right now.
Mr. Harmandeep Singh, for sharing your perspective. Now I'll come to Mr. Subramanyam from the Medicover Hospital to share his initial remarks. Over to you, Mr. Subramanyam.
Yeah, thank you. So I think as Harmandeep Singh said, this COVID has showed that how technology is very important to healthcare institutions. Particularly, one is that patients who are coming to hospital had become less during the COVID period, right? And second thing, for that anyway, we have to work on teleconsultation kind of thing, and we have to give mobile apps to the patients so that they can raise emergencies through applications, and they can have teleconsultation and they can order for medicines kind of thing. So, and second thing, when people are, it's very necessary to come to hospital. So their hospitals should make sure the patient, health and security. Now, in this case, definitely AI cameras will play a major role, right? So first thing, when the patient and patient attendants are coming, so we have to see that the temperature initially. So instead of entering into the hospital, while entering itself, we have to identify what is the temperature of those patients, and we need to get alert so that we can take care from there itself. We can redirect those patients or patient attendants from there to COVID area or other clinical service area. Second thing, at the same time, not only patients, for even employees as well, employees or staff, it is more important who are working in hospitals. Their security. If they are, affected with COVID, so we will not get people who can serve to the patients really. So for that, we need to take care of, some distance between the employees even, and even like major thing is that every employee morning when comes to a hospital, he will go for this attendance, right? Either they will write it on the book or they may go for the biometric machine to put the fingerprint, right? So now here it is very important that we have to go for the touchless attendance, so that this is one area it will avoid. Otherwise, one employee may have the symptom. There is a much chance that spread to multiple employees, right? Then let us third one is with AI. When one time the patient is identified as a COVID, he is affected with COVID. So in 21 days, 28 days, he should be quarantined, right? So during that period, if that person again coming to hospital, so AI can give really alert to the staff. This particular patient is having already COVID, so he should not just go inside the hospital around. And again, few areas if we wanted to really restrict, like we are having COVID patients as well as the regular patients. So COVID patient area, we should restrict that, so that regular people should not go that side. So all these things, we have come across this COVID period, and it is the decisions we have taken, or any healthcare provider has to take a faster decision to implement all these things, right? And again, when it comes to AI or machine learning, so we have seen that vaccination come very faster this time. Usually vaccination will take years together, but this time it has come very faster. So in this case, we got this AI and machine learning helped a lot by taking that. For example, if you take X-rays, CTs, all these things. So by collecting X-rays and CTs of multiple patients to understand what actually going wrong, or what are the similarities when for the patients who are actually got the COVID. So there they have analyzed it much faster, and it actually helped them to get the better vaccination, right? So this is how. And when anyway, that blockchain is a very good thing, that is upcoming technology, so which will be more secure, even though it has to be proved some more, because it is even in the midterm, it is not that full-fledged available for all the areas. Only we know that when Bitcoin comes into the market, so we came to know about blockchain, and people know about blockchain and Bitcoin together. But in fact, blockchain is the technology which actually helps a lot for the healthcare industry, particularly, if you see in India, electronic health record as an open record across the country is like a dream, right? So blockchain will help us with the better security, and in future, that is the technology which will help us to get the EHR in India. Of course, it is across the world. Yeah, I think.
Thank you, Mr. Subramanyam. I'll come to you for the second round. As you have rightly said, the artificial intelligence, these emerging technologies have helped us to better monitor, and we are also looking forward for technologies like blockchain to integration and to a larger extent of their use. Now I come to Mr. Huzaifa T. Merchant. Mr. Merchant, we would like to have your perspective to what extent your organization has integrated these technologies and making use of them to change the overall scenario and ecosystem. Over to you, Mr. Merchant.
Thank you, Sudheer. Well, today we are looking at discussing the importance of technologies, emerging technologies like AI, machine learning, blockchain, robotics, robotic surgeries. Uh, I would like to begin my talk with a different perspective. Here we have to take into account two major factors that most of these technologies and these words that have been coined for these technologies have not been invented as of today. They have been, in fact, a part of a gradual evolving process. The two factors that I would like to speak about is the advancements that have enabled these technologies to surface and for us to see the benefits of these technologies is the advancements in the core IT technologies. And the second important factor I feel is the advancements in medical science related technologies. Now, we have often heard that necessity is the mother of all inventions. So, as people have started getting involved into seriously complicated algorithms and dealing with more and more complex issues, more and more opportunities have evolved, leading to advancements in technologies, systems, and processes, which in turn have led to higher efficiency and greater productivity. And all this, as I said, is not just in the present times. If we take a look back into time, it was in the 19th century that the analytical engine was designed by a maths professor on which the basic framework of today's computers was based on. If you see, since then, the IT systems and infrastructural advancements, supported by better and better software capabilities, have set the perfect platform for today's health ecosystem to evolve and be revolutionized. If you see the trend of computerization to digitization to digital transformation, the journey has been a rewarding and enriching one for most of us. Computerization has enabled most of our processes and systems to be available online. Performing interdepartmental tasks, day-to-day functions have suddenly started looking so easy that it has now become second nature to us. On the other hand, digitization has set the tone for moving towards paperless offices and reduction in paper generation itself. It has also set the perfect platform for creating online medical records. Today, we are hearing discussions and plans at the national level for e-health records in the future, wherein a patient can go into any healthcare facility and his medical records will be available online. What has happened is that while both computerization and digitization have offered immense value and advantages to one and all, it has also inadvertently set the stage for digital transformation and use of emerging technologies such as big data analytics, artificial intelligence, deep learning, machine language, and robotics. Sorry. This has become possible as a result of the huge data set having accumulated with business organizations over the years of computerized operations. Coming to the second major factor, the advancements in medical science related technologies. Here again, the first technological advancements goes as back as in 1928, when the first ventilator was created. Before that, a device known as a pulmotor was used, which used to simply disperse oxygen through a face mask until a set pressure was reached in the lungs, at which point in time it switched over to exhalation. Since then, we now have ventilators that sense the breathing pattern of the patient and adapt to it automatically. So is the case with medical equipments used in medical care facilities, clinics, primary care centers, tertiary care hospitals. Today, the availability of portable medical equipment such as oximeter, blood sugar meters, portable ECG have enabled remote patient care and management, making it easy for both the doctor and the patient in facilitating healthcare services. Today, a doctor sitting in the hospital can get the ECG report of a patient being transmitted in the ambulance and facilitate in making preparations for the patient before he even reaches the hospital. Here, I would like to mention about two important disruptions that have had a very big impact on provision of healthcare services. The first is the mobile phone or smartphone as we all know it. Two things have happened here. Senior doctors who never had computers as their topic suddenly found it easier to accept and adapt to mobile-based technology and medical software advancements revolving around the mobile technology. Remote patient tracking and monitoring, reporting, messaging, accessing medical information, learning, and updation have been seen to have picked up considerably. The second is, of course, the current pandemic situation itself. Technologies such as telemedicine and teleconsultation have always been around for decades, but were not seen to have derived any interest in patients and doctors alike. The concept of doctors physically seeing patients has been disrupted by this pandemic. That will be all for this session, Sudhir. It's over to you, Sudhir.
Thank you, Mr. Muslim. Now I would like to come to to each of the speakers. Like, what are the challenges that you're facing in rolling out these technologies? Mr. Singh, I'll come to you. You might be having the Rainbow Children Hospital has changed across, even in Karnataka, you have changed across the country. So we would like to know what are the challenges that you're facing while rolling out this technology, and since the public who are visiting the hospital or who are trying to avail these services, they are still not used to it. And what is the level of acceptance for the healthcare services that are being provided in through these use in through the use of these technologies?
So I would say I'll start with the last question of yours first. Is that see, the demand for all these solutions has been tremendous. People really want to access the technology, access healthcare using all these technologies in today's world. So in terms of demand, yes, there has been no challenge, but the challenge is how to quickly come up with these solutions which can leverage these technologies and then get into terms of the adoption by the clinical staff. That is the I would say that has been the history, and in the future also for coming few years that could be a challenge for any hospital chain, how to get their employees to use the technology to the fullest and deliver better healthcare. I would say, as Mr. Merchant said, that with the telephones, or rather, I would say the touch mobile phones coming in, the access to all these technological solutions by either the customers or the doctors has been eased to the fullest. And with AI and machine learning coming into the picture in the future, the experience is going to be enhanced. So it is how soon we as technologists can identify and build solutions on top of these technologies, which can enable healthcare delivery to the patient. So I think that will be the more challenging part for leaders like us. The demand is there, and with COVID, the demand has, I would say, increased multifold. Whether it is home care delivery, or whether it is delivery of health within the hospital, and with COVID coming in, the demand for quicker delivery of healthcare, whether in terms of expecting the result reported, the accuracy, the security, all that, the expectations of the customer has increased like anything.
I had a recent experience where, because of these technologies, the moment a patient gets into the hospital, insurance, the kind of insurance that is claimed, is immediately comes to his mobile phone, and also the kind of uh, the diagnostic reports comes to the mobile phone. And at the same time, I'll come to Mr. Subramanyam. So to what extent is there a role that government has to play, or the government is struggling on their own to provide the public health, providing these care technologies and all? Over to you, Mr. Subramanyam.
Yeah. So as I said, when it comes to government to implement, proper healthcare, which were actually they were discussing from long years, but till now it is not in the implementation stage. So that is where blockchain will really help it out to keep that patient health records onto the public. But it is not that open to everybody. But yes, the common public health record, patient health record will be there, which can be utilized during his treatment, and his entire electronic medical record available with any particular service provider, right? During his service, availing the service, right? So one is that for patient entire history will be there. Second thing, that let us say blood bags will have a very limited period of expiry, right? It will, even though you collect it from people, donors, so it will not be there for it's like based on the blood group, blood type, so it can stay up to 45 days maximum. So you cannot keep this long period. But when it comes to blockchain, so you will know across the country where and all these blood bags are available. So whoever really requires, once they give the input that this particular blood bag type is required, whether it is based on blood bag component, once they put it, so immediately they can get this nearby this particular institute or hospital having these blood bags. So this will actually save the patient life, as well as that we can utilize this blood instead of not discarding that after expiring. And third one, when it comes to medicines, we know that when you are having medicines across the hospitals, right? Maybe even if you take government hospital, there will be bulk drugs available, and they may not look at drugs till the expiry. Once the audit is happening, then only they will come to know that this medicine is getting expired, right? Maybe there are a lot of hospitals which are not having the medicine, and few hospitals which are having more medicine and it gets expiring. But when it comes to the blockchain technology, and this all the information is available in that, and at least in the government hospital group or in the private hospital group, any of them. So they will know where is the medicine is going to expiry and where is the necessity, where the consumption is more. So based on that, this near expiry medicine can be moved and utilized it properly, right? And then the other one, when it comes to insurance, right? So insurance still we are not get integrated with hospitals, right? We have to take manual papers and we have to scan it or submit it to them through online. So, and they will review, they go through all those things, and they have to see the clinical history or what treatment is going on. Everything has to be checked, then only we will get the approval, right? And sometimes it may not be accurate because they may not, there may be some complications as well. So initially they give some approval, after that later these people have to put again for approval and they get it. But this one actually gets delayed. But when it comes to blockchain, so we will get transparency in the claims, and second thing, we will get very faster approvals. So because of due to this one, sometimes when approval gets delayed, so they may postpone the surgeries as well, right?
Yeah.
So these and all will help out with the blockchain.
Yeah. Now I come to Mr. Merchant. There are a very specific question I would like to ask you. With the use of these technologies, the end results, of course, these are being used by the administrative staff and the staff that are in the hospital, and is as Mr. Subramanyam mentioned, the results are the process is become quicker. At the same time, there are many these technologies are integrated within the hospital administration, but not the results are coming to the patient. Are the patients feeling these technology through the quicker processing processing of this within the hospital, or do you think there are some challenges in terms of integration, and there is a capacity building that is needed within the hospitals or the administration of hospitals?
Very nice question, Sudheer. See, what has happened is that artificial intelligence simplifies the lives of the patients, doctors, and hospital administrators by performing tasks that are typically done by humans, but with considerably reduced time frames and added enhanced capabilities at times. Now, this in turn is seen to lead to greater productivity and higher efficiency. If you ask about the implementation and the importance and the advantages, there are countless applications in healthcare. India is such a diverse population. In the current healthcare scenario, there's still a huge demand-supply gap on both fronts between patients and hospital beds, as well as patients and doctors. Even the availability of trained healthcare clinicians in most remote locations in the country is still lacking. So India has room for innovative, sustainable, and scalable healthcare technology to improve lives. Uh, However, what we see is that in a country of billions of people, many now, which many cities and many locations are now becoming equipped with internet connections and smartphones. But it is still difficult to name more than a handful of examples of digital transformation technology initiatives that have significantly impacted healthcare outcomes or being widely used. The last decade has seen some great examples of dedicated hardware and technology that is engineered for the unique challenges of Indian health ecosystem. I often say that technology and systems are only as best as the people using it. So when you spoke of challenge, the biggest challenge is our people itself and their readiness to adapt and their capability of adapting and using that technology to the fullest. If I were to give you a very ground level example, uh, we all use a smart TV at our home, right? How many of us have even gone ahead and explored all the functions and the buttons of which are present on the buttons of a remote of the TV? We don't do that, right? So that is the state of affairs right now as it is. Okay, but we as Indians are truly privileged to have some of the rarest medical cases being successfully diagnosed and treated by our doctors, even especially in times when they did not have the latest technologies available to them. Now, we at Safety Hospital have always tried to implement the latest equipment and make use of modern emerging technologies as they evolve. The reason being very simple that each advancement in technology enables far more in-depth analytical and diagnostic capabilities to our doctors in treating the patients. In today's times, any technology or equipment or system which helps reduce the time taken to diagnose or in improving the quality of the diagnosis itself or which is enhancing the predictive analysis and analytical capabilities while treating the patients is a very major advantage. Okay. Now, our systems have made it possible for seamless integration of all patient-related functions. This in turn has enabled availability of all patient-related information to the concerned stakeholders at the right time, at the right place, at the right moment. It has also provided for improved patient management and continuity of patient care, which is very important. See, the patient can come and he can go, but then after post-surgery, so many of the time, most of the time, the patient requires follow-up, constant follow-up and aftercare, which is to be taken. So that is the avenue where continuity of patient care comes in. We are also deploying technologies such as speech recognition, facial recognition, and robotics. One avenue where we are trying to use artificial intelligence is an increasing contactless operations, because in the current time the main source of infection is hand contact. Okay, so we are trying to increase contactless operations in different areas in the hospital. We are also planning to use the technology for evacuation and people disaster management in the future. We are also we are in the development phase in that. Now, another robotic technology that we have offered to our patients is robotic surgeries. Okay, it was in 2000 that the first robotic surgical platform became available, commercially available in the US, which was cleared by the FDA for use in general laparoscopic surgery. Now, the technology has offered improved outcomes for physicians and patients alike. The system is a remarkable improvement over a conventional laparoscopy. The major in the conventional surgeries, what would happen is to move the instruments or to reposition the camera, the surgeon used to have to move his hands, which were counterintuitive movements. Whereas here, in contrast, the robotic surgeries are non-autonomous. They are controlled totally by the operating surgeon. We have performed robotic surgeries for more than 600 patients till date. Mostly the nature of such surgeries involves multi-specialty complexities such as urology, thoracic, general, abdominal, and so on. Uh, it is robotic surgery is considered today as the gold standard for treating radical prostatectomy patients for prostate cancer. It has proved highly beneficial in cancer removal, ventral hernia, partial nephrectomy, radical hysterectomy, and such cases. The traditional surgery involved the surgeon looking up and away from the instruments to a nearby 2D video monitor to see an image of the target anatomy. The surgeon also had to rely on his patient side assistant to position the camera correctly. Also, like I said, the movement of the surgeon's hand was counterintuitive. So, if the surgeon had to move his apparatus to the left, he would have to move his hand to the right. The equipment used in conventional surgeries were handheld, long shafted instruments that could bend or rotate only. So, despite all these limitations, it was the sheer capability of the surgeon at the end of the day which has enabled such a high success rate of such surgeries. In contrast, what the robotic surgery system offers many benefits. Main benefits is that it allows the surgeon to operate from a comfortable seated position at the console with eyes and hands positioned in line with the instruments. The doctor gets an immersive 3D 10x 10 times magnified full HD view of the entire operation as if he was immersed inside the patient's body. His hand movements are intuitive. The apparatus gets 560-degree wristed movements when the equipment is inserted inside. As such, the doctor is able to get a feeling of looking directly into the patient's abdomen to the point that he is able to see each blood vessel like a pipe and also feel how deep he has gone, which previously with the 2D image it was not possible. Uh, Now, what is there in this for the patient? So, how has this helped the patients? So, and the first point is that the amount of gas that would be required in such laparoscopy surgeries is considerably lower. Now, this combined with all the above benefits that I just listed, what it means for the patient is lesser pain, lesser bleeding, faster recovery, minimal risk of conversion. We have seen patients who otherwise would have been complaining for pain after the surgery. They are able to walk at their normal pace. Patients who would have otherwise needed ICU stay post surgery have been observed to recover without it. Okay. So these are some of the benefits and the advantages of all these emerging technologies that are there. Over to you,
Yeah.
Sudheer.
Yeah, thank you, Mr. Merchant. As rightly mentioned, we come across uh, I mean to say, the campaigns and the various hoardings from various hospitals, like how useful these robotic surgeries are, and just with a spine, I mean, say a pinhole surgery is done, and all this bleeding, which used to be with open surgeries and all, has come down drastically. Now, before I come to the conclusion of this session, I would like to take the parting or concluding remarks from each of you. All three of you, the eminent speakers who have joined us, are heading the IT wing of the respective institutions. Now, I would like to come to Mr. Harmandeep Singh for a quick remark. And you being a IT head, VP IT in the Rainbow Children's Hospital, in the coming years, at least for the next 5 years, what is the change you would like to see so that there is a seamless processing at the same time? The patients have that benefit those fruits of these technologies. What is the vision you would like to see in the coming years as a IT leader in the healthcare industry?
See, I think with all these technologies coming in and with COVID coming in, the hospitals have been pushed. The ones which were not even thinking of have been pushed to go towards digitization. So, what I think in the next 5 years, every hospital in India across the world should focus on is the access to information to the patient. That is very important. And obviously, with the access to information, the confidentiality and the security also comes into the picture. At the same time, the more transparency we can bring in terms of the clinical care as well as the financials associated to the care is what I think is the need of the hour. Because a lot of patients, I do get a lot of feedbacks from patients that these days the care is not very transparent. I don't know what the doctor is doing and things like that. At the same time, how we can get the clinicians to collaborate with each other within the organization, across the organization using these technologies is what I can think of right now will be very, very, very useful to the patients, because ultimately the patient is the one who is, in a way, you should not say it, but is a customer to a hospital. So the
Yes.
better care and the care with transparency we can provide to the patient is going to be very, very critical. Now, in order to provide that, you will need to have a lot of digitization to be done at your end, which is the hospital end, whether it is in terms of the clinical data, non-clinical data, how the clinical, non-clinical systems talk to each other, the turnaround times, as I was answering in my previous answer to your question. So how you can ensure that all your lab reports, your other test data is getting reported to quickly with efficiency, as Mr. Merchant talked about, how efficient I can be in terms of the output which we give to the patient. Early diagnosis is another very key important area where we can assist the patients. A lot of times it happens that that certain ailments don't get diagnosed in time. So specifically in cancer care, I've seen multiple other hospital chains leveraging AI and machine learning. So I think these are the few things where, as a hospital, one needs to adopt different technologies and see how they can ease the customer experience, both in terms of the clinical care and in the non-clinical aspect, as Subramanyam talked about in terms of the insurance processing and other stuff. A lot of times, the data exchange happens between the insurance company and the hospital just because the person who was submitting the data was not very vigilant. So we are currently using RPA as a tool to ensure that the data which is getting pushed to the insurance companies uh, is uh, is is correct, and all the checks and balances are being done before the data is being shared. So I think these are the few things which I can think of right now will be
Amazing.
very useful
Amazing, Mr. Singh,
going
as you
forward.
rightly said, it is ultimately the patient who needs to get those benefits, and the ease needs to be improved. Now, the concluding remarks from Mr. Subramanyam.
Yeah. So usually patient expectation is that one, which hospital he has to reach if he is for his treatment, and once he get into that hospital, what kind of treatment he will get it, how best treatment as well as how optimized costing with the optimized costing, he is getting that treatment. These are more important for any patient. It's an expectation of the patient. So now, due to this pandemic, I think almost all hospitals have started their mobile apps to reach to the patients. So in that, everything they will integrate it. One is they may integrate it with their call center to give for any queries they can easily approachable. Second thing, every hospital they have started home care services, so that they can give services to either doctor or nurse or even physiotherapy or even for sample collection like that. So that is where they are going to the patients instead of bringing the patients to here. And the third one, yes, senior consultant involvement is required. So every hospital is moving ahead for the teleconsultation, right? So like this, all these things are every hospital has started it, and hopefully in maybe it may not take more time. At least next 2 to 3 years, almost all hospitals will have all these features. And apart from this, few things still we need to get improved with respect to, as I said, patient records. And second thing is this government has to come up and bring it more insurance policies, to the patient, so that their healthcare effort will be easy. Because now we see, I'm sure more than 30%, not more than, but only up to 30% people are having healthcare insurance. Maybe around 70% of people are not having insurance. Even few people not aware of what is insurance. So I think this has to go into the public more, and at least from government side, at least basic health insurance they have to provide it so that they can take the treatment well in the hospitals. Of course,
Yes.
government has given treatment like either for smaller employees like ESI, they are providing it, and they are having the government employees, CGHS and all. But if you see real practically, those rates really not worth to hospital, because those rates are like, if you take CGHS 2002, those rates still we are continuing in the hospital. So hospitals are not even not think about it profit, but they are not getting actual cost as well. So government has to relook at all these things. Otherwise, this, because of due to this one, corporate these government employees or smaller employees who are availing this ESI service, they are really not getting to the bigger corporates and get the better treatment. So that government has to take care. Second thing, government also has to invest on this data mining, so that they will know they will get the clarity on the actual cost of the treatment, so that they, based on that, they can revise these prices and all. So which will really help to the either staff or employees or patients, whoever is going to treatment through government policies.
Absolutely right. There is a increased, there is a necessity for a increased awareness in terms of insurance, as Mr. Subramanyam rightly mentioned, and of course, the cost that the government is providing through insurances and the insurance companies is very much essential. That needs to be discussed in a different. That is a debatable and a point to be discussed in length. Yeah. Now I would
Yeah,
like to
yeah.
have
So
a
I did. That's where. So to get that government, to get that
benefits. Yeah.
actual price, they have to do the data mining on this, all this treatment expenditures, so that they will come to know
Yes.
what is the proper cost.
The cost that the hospitals are incurring. Yeah. Now, Mr. Merchant, your concluding remarks on the same lines for the same question.
Thank you, Sudheer. Uh, Definitely, as I see it, the combination of these emerging technologies such as AI, ML, robotics, etc., is going to definitely play an important part in the future. However, I would like to share my concluding remarks in three aspects. One is that the key takeaway that we have, that I have observed personally, and that is during my interactions with other vendors, with my colleagues in the industry, in the healthcare, is that the what has surfaced is that whenever we are implementing and using, as we keep on, as we have used these emerging technologies, the somewhere I feel is that the understanding of the people in implementing those systems, or when they have asked for those systems, or when they have designed those systems, needs to be revisited with a far deeper understanding. The point that I'm trying to make is that the quality of the data and the type of data being collected is very important. Okay, so you can without the right set of data being entered, systems is only what goes in, it comes out. So systems is it will take the information that you feed into it, process it, and process the data and give you processed information out. So that quality of data and the type of data being collected is very important. That is one. Second is that yes, we all are seeing an emerging trend which is already there, and this trend will continue. The trend that I'm speaking of is a joint effort between the doctor and the technologies. So the technologists who are offering the technologies and the doctors have to can go a long way further together. The focus of medication is not always just to treat the patients for his current ailment, but also to analyze and diagnose from the perspective of seeing what was the underlying root cause which has led to the current state of the patient. See, not all patients are born with diseases. A perfectly healthy person can also develop a lifestyle disease. This is true especially in India, with so many obesity, diabetes, blood pressure, heart patients, cancer patients. So, if I feel that the doctors and technologists in the future will need to look at that avenue, wherein during the pre-assessment, if or the assessment of the situation, and during the ongoing treatment, if technology can help them. We have already seen what Watson and other Google and IBM vendors analytical capabilities are being offered by them. So that is something to be looked up in the future. Now, that underlying cause could be a lifestyle change issue or a habit developed by the patient. So I feel that technology has reached that state that it can effectively help in assisting the assistant doctors and primary healthcare personnel derive conclusive diagnosis based on a given set of data collected by them from the patient. Now, this is not just true in tertiary care hospitals where doctors and come as consulting doctors, but imagine a telemedicine approach. Even this, it could be true for that approach also. Okay. The third aspect is for patients who come with ailments and who could be looked at being assisted with predictive analysis based on the current and past ailments and the course of treatment towards avoiding further ailments that could that the patient would have been likely to develop without such monitoring. Okay. Thank you, Sudheer. Over to you.
Thank you very much, Ms. Merchant, and all Mr. Harmandeep Singh, who is the IT Vice President from the Rainbow Children's Hospital, IT Head from Medicover Hospital, Mr. Subramanyam, MV, and also Huzefa T. Merchant from the Safi Hospital, Mumbai, Maharashtra. I would like to thank all the esteemed panelists for joining us. A pleasure to have you on both. We would be coming out with this discussion, a conference report of this discussion, and in the next edition, we would also be coming out with this conference report, which would be reaching out to you soon, and my team will be connecting with you on that. So, with this, we would conclude this particular session, and after a break, we will be having a technology presentation by Mr. Raul Kallo, who is the CEO and founder of VBO Health, followed by very interesting panel discussion on leveraging, of course, standard strengthening the health system to improve the outcomes. Thank you very much. My name is Sudheer Goutham, head for South India and resident editor with APAC News Network. Thank you very much, everyone, for joining us.
Thank you.